Welcome to this Oncology Data Advisor interview featuring our coverage of the 2025 ONS Congress, as well as our spotlight on Oncology Nursing Month in May. Our guest today is Dr. Martin Michalowski, who is an associate professor in the School of Nursing and co-director of the Center for Nursing Informatics at the University of Minnesota. At ONS, Dr. Michalowski presented a session titled Empowering Oncology Nursing with Clinical Decision Support Systems, Enhancing Care Through AI and Data Integration. And today he's here to tell us more about this presentation and the evolving role of AI in oncology nursing. Dr. Michalowski, thanks so much for coming on the show today.
Thanks a lot for having me.
Would you like to start off by introducing yourself and sharing a little bit about what you do?
Sure. So as you had mentioned earlier, I'm a professor in the School of Nursing at the University of Minnesota. My background is in computer science. I have a PhD in AI very broadly, automated reasoning more specifically. I spent about 10 years in a private research lab working on various AI related and automated related problems from health to DoD to education. And then about 7 years ago, I started at the University of Minnesota. I learned about nursing before I started there. I didn't know much about it, but found it to be a really interesting and ripe area for some of the expertise that I had. And for the past 7 years, I've been working on helping nurses understand AI and applying AI across various problems within nursing and healthcare.
That's amazing. Looking forward to hearing more about this today. So I'd like to tell us a little bit about your presentation at ONS about empowering and enhancing oncology nursing through AI and data integration.
Yeah, so at the talk, discussed some research that myself and colleagues have performed around clinical decision support and how to build clinical decision support systems using various AI methodologies. The talk kind of gave a brief overview of a clinical decision support system called MitPlan that we developed, which is an acronym for mitigation planning. So it's focused on addressing a treatment planning for multimorbid patients. We use several AI techniques, including automated planning, explainable AI, data integration, knowledge representation. So a lot of different things go into solving that problem, which is quite a complex problem. And then the talk kind of focused on towards the end around the explainability component of the system. So how do you explain those treatment decisions that are being made on behalf, well, to augment and to support the end user, which in our case is a point of care physician. And yeah, just it was really great conversation. We talked about a paper that won a Best Paper Award at the AI Medicine Conference last year, and really just talked about opportunities for using AI in this context, in this clinical decision-making context, and also specifically within oncology nursing. So how can nurses leverage these technologies? And the use case that we used was focused on oncology.
Amazing. And we'll definitely link to your presentation in the interview so that anybody who's interested in hearing more about it can check that out.
Right.
Would you like to tell us a little bit more about a few of these different systems you mentioned, the different ways that AI can be applied in the clinical setting and patient outcomes, and how these applications are beneficial?
Sure. Yeah. So specifically about what I talked about, so we really do use advanced AI methods to integrate a lot of different types of data together to make better treatment decisions. There's a lot of information from clinical practice guidelines to adverse reaction repositories to just a lot of healthcare data out there. And AI is a great kind of, I'm using the term AI very broadly. There's kind of specific methodologies, but the technology in general provides a really good integrating platform. So to bring all these data together in a way where you can then reason over these data and make better treatment decisions. And as I mentioned, what's really important from the perspective of deploying these systems in practice is also explaining the rationale behind the decisions that were made as a way to increase trust in systems from a physician's perspective or a nurse's perspective, a caregiver's perspective, um, to also being able to explain those decisions to the patient, right? So more patient-centered approaches where they're also potentially involved in the decision-making process through eliciting preferences from them and taking those into account when coming up with treatments. So, if a patient is concerned about cost of medication or certain administrative modes, those can also be taken into consideration when deploying these systems. So really, this clinical decision support space is a really good one that highlights the potential real savings and opportunities that these technologies provide. So that's kind of what we focused on. But I mean, more broadly speaking, in oncology, nursing, and there are really, any technology can really help in many, many different ways, from, as I mentioned, decision making to and data entry, right, documentation, to diagnostics, to patient education, right? So it kind of spans the whole range of the healthcare process. We can call it, and it's a real opportunity. And in my role as faculty at the School of Nursing, I really try to, I'd say, advocate for nurses to really take a strong position in designing, developing, and deploying these technologies, and that requires them to understand them to a certain degree. So I think, yeah, that it's a real opportunity, and one that we see, is being used in practice today, and will only continue to be used even more.
Absolutely. Sounds like the possibilities are really endless and a lot of different
Yeah,
areas that it
yeah.
can fit. So awesome. It's exciting to hear about. So what are some of the what's some of the past and present research that has studied the integration of AI tools in healthcare?
I mean, that's a tough question to answer because I would say at this point, there's just so much of it out there. I think we are far beyond the point of if these technologies will be integrated, but more when and to what extent. So I mean, the research really spans the entire spectrum, from really methodologically focused research, which is some of what we do to ensure that everything that's coming out of these systems is sound, is explainable. When you talk about work, since we do use LLMs in our large language models in our work as well, ensuring that the information coming out is correct or vetted medically, is clinically useful. So there's a lot of research in that space. There's a lot of research also focused on the patient, so patient education, patient compliance, just helping the patient with their treatment, and ensuring that they have the best possible outcomes through adherence to the treatment that they've been prescribed. Right, there's a lot of research showing that better outcomes don't necessarily come from better drugs, but better adherence to existing treatments. So, and that's just a tip of the iceberg. I mean, we could spend hours talking about the different types of research that's going on in the space, but it's really exciting. It's changing quickly. It's important research, and it's important to, especially for nurses, to be involved in helping again with the deployment of these technologies in practice, only because they are intimately familiar with the entire process, and they understand kind of what are the issues and how to articulate those issues to kind of more traditional technology or AI developers, right? So the solutions developed really are addressing important problems rather than solutions being developed and then looking for problems. That's not an approach that works particularly well in healthcare. So I think nurses play a very important role in that process.
Yes, absolutely. With how extremely fast the field is evolving as new technologies come onto the scene, do you have any advice for nurses about how they can try to keep up with all the research and kind of stay abreast as all these new things come into play?
Yeah, I do. I mean, it's evolving extremely quickly, and it's hard for me as somebody who is in that space to stay up to date. But a question that came up during my talk at the Congress, which I'll kind of reiterate the answer here. I think consumer AI very broadly has gotten to the stage where it's very accessible. About 5 years ago, if you wanted to use large language models or build predictive models yourself, you kind of needed to use tools that were developed in research labs, not very accessible from a user perspective. But now consumer AI is so incredibly out there and easy to use that there's really no excuse not to use it in some way. So it's difficult to stay abreast as far as all the methodologies and all the approaches that are coming out from an AI perspective. But, everyone can use a large language model, right? ChatGPT, Perplexity, name your model. There's a very friendly user interface that allows you to interact with the technology to see how it works, to start understanding a little bit of its limitations and what its strengths. And similarly for anything from building predictive models, there are very easy to use tools that allow you to kind of just drag and drop data and build a pipeline, a machine learning pipeline, for example. So I think, you know, uh, the, the advice I would have is really use the technologies, understand them at a level where when decisions are made at a practice from a practice perspective, that you have, kind of a lens that you can view that from, understanding kind of just the basics of what these technologies do. And I think that's really important. And one thing that I work on in my role as faculty is really trying to raise basic AI competencies for nurses. So just providing them with the skills and the understanding where they can make some of these decisions better moving forward. Because again, we're not at a point where it's a question of if these technologies will affect practice. It's they are, they will, and they will even more in the future. So it's important that, as practitioners or nurses specifically, have a basic understanding of what it is they're using, right? I'm not expecting them to have computer science degrees, but if I ask a question like, is a large language model or a deep learning approach appropriate here? I think, current and future nurses should be able to answer that question, just understanding the differences between, deep learning models and maybe regression models and or decision trees or things that are kind of simpler in that sense.
Absolutely. I'm sure it's always a learning curve at first, but something that will
Right.
greatly improve daily practice as we go.
Yep, I agree.
Awesome. So with all these new technologies, the ones that are both here and coming down the pipeline, what would you say is what you're most looking forward to as far as AI integration into oncology nursing in the future?
I'm actually really encouraged by the type of nurses that I see applying to graduate schools. So I'm very biased around those that I work with and in our school, but I've really seen a transition in the skill set that those candidates bring. So, when I started at the University of Minnesota School of Nursing, I didn't see any doctoral candidates, whether they were DNP or PhD, showing up with programming skills or really much baseline knowledge about these technologies. And now I see these candidates, nursing candidates, showing up, interested in deep learning and data ethics and explainable AI, which is really encouraging for me. So I'm it's a little bit of a cop out answer to your question, but uh, as a technologist and someone, who lives and breathes various aspects of AI, I'm very excited in general about the potential of these technologies and in ultimately helping, improve patient outcomes. So there are a lot of considerations that need to go in before you deploy these and use them in a patient context. But I would say, just broadly speaking, it's a very exciting space. There's really a lot of potential across the board, not talking about a specific technology or methodology, but it can just make nurses' lives much easier, make patients' lives easier. So that's very exciting, but I really am excited about kind of what the future nurse will look like. And we're starting to see a little bit of a change in kind of the profile of those future nurses that we're educating now. And I think that's really exciting, and it'll enable true interdisciplinary research, across many disciplines, which is important for optimizing patient outcomes and patient care. So that's really exciting for me. It's just opening up a lot of possibilities that I don't think that we talked about previously, but were they seemed less likely to happen. And I think now, given the kind of the skill sets that nurses are leaving schools with, and the familiarity they have with technologies and the comfort that they have in using them, I think we'll see a really significant change in what a nurse is in the near term. It's no longer kind of this, way out there in the future thing. I think it's coming much sooner, and that's pretty exciting.
It's really exciting, all these new skills and opportunities that are opening up.
Yeah.
Yep. All right. So my last question for you, since May is Oncology Nursing Month, do you have any take-home messages you'd like to share about how AI is impacting oncology nursing and what nurses should know about this evolving landscape?
Take home message I would say is it's an opportunity. Um, it's scary. We have a fear of the unknown, and a lot of it, just because nurses didn't need to be trained in these technologies. They aren't as familiar as someone like myself who, lives and breathes it, from a training perspective in grad school through, my research that I do now. But it really is an opportunity to augment what nurses do, to provide better care. So if seen from that lens, I think, it would really help shepherd some of these technologies into practice that can really help and make a difference. So I would say, embrace them. They're here to stay, but they're also here to help. And I think, looking at it that way may allow more of these kind of breakthrough technologies to see practice, and for nurses to really, yeah, to be excited about them versus worried about them. And I don't ever mean to downplay, the kind of the difficult questions you have to ask of these technologies, and that it's not all roses. It is a difficult thing to deploy in practice, but with the right mindset, I think, nurses can really lead this charge, and they should. So it's a great opportunity for oncology nursing and nursing more broadly.
Absolutely. It's really exciting to hear how AI is impacting not only daily practice, but also, improving patient outcomes overall. So
Yeah.
thank you so much, Dr. Michalowski, for coming on today to tell us about this. Great addition for Oncology Nursing Month, because that, like you said, the future is here. So it's something that is impacting everybody right now. And we're excited to hear about all these new possibilities that it's opened up. So thank you again.
Yeah, thank you. It was fun talking to you.